be studying about circle of Willis. This is very much important topic, circle of Willis, and at times it is maybe important for pathological point of view as well as for the clinical point of view as well. So circle of Willis is basically the communication between the internal carotid artery system in the brain, internal carotid artery system, and दूसरा होता है आपका vertebral artery, two vertebral arteries and one basilar artery. So vertebrobasilar system. So it is the basically communication between the internal carotid artery system and vertebrobasilar artery system. So this is circle of Willis. So circle of Willis is basically made by the vertebral arteries, two vertebral arteries. So vertebral arteries are branch of subclavian arteries. So these are the branch of subclavian arteries. Okay. Now these are the two vertebral arteries. One is right, second is left vertebral artery. Now both the vertebral arteries are uniting and forming a basilar artery. So this is the basilar artery. Basilar artery. Now this basilar artery is further dividing and forming the posterior cerebral artery. The posterior cerebral artery. So this is the posterior cerebral artery which is formed by the basilar artery, posterior cerebral artery. Okay. Now this is internal carotid artery. This is internal carotid artery, and it's having two branches. One is the anterior cerebral artery. This is anterior cerebral artery, and one is the middle cerebral artery. So this is the middle cerebral artery. Okay. Now this internal carotid artery is having the communication with the posterior cerebral artery by this posterior communicating artery. So there is a communication which is known as posterior communicating artery. So this is internal carotid artery, this is the middle cerebral artery, and this is anterior cerebral artery, and this is posterior communicating artery. And there is a one more artery between the two anterior cerebral artery. This is anterior communicating artery. Okay. So this is the circle of Willis, and it's having different small branches, like the basilar artery is having various pontine arteries, and one is superior cerebellar arteries, superior cerebellar artery, and the anteroinferior cerebellar artery, and posterior inferior cerebellar artery is a branch of vertebral artery. Posterior inferior cerebellar artery is a branch of vertebral artery. Now this is the complete circle of Willis, and there is a pituitary gland. The gland is there in the area at the base of brain. So this is the base of brain where circle of Willis is situated, and there is a pituitary stalk and optic chiasma right there. So this is known as interpeduncular fossa. This area is known as interpeduncular fossa that is surrounded by circle of Willis. Now the circle of Willis is thus the communication between the internal carotid artery system and vertebrobasilar artery system. So this is there are two communication between the internal carotid artery and vertebrobasilar artery system. So this is the circle of Willis. Now why this circle of Willis is important? Why we need to study the circle of Willis? Because what happens, there are various pathological changes are there in the circle of Willis, like the formation of aneurysm, So what is an aneurysm? Aneurysm is basically the defective outpouching in the wall of any vessel, and in this aneurysm the vasa media, the muscular layer is absent. So that's why there is a outpouching, So this aneurysm is very much important while dealing with this kind of the pathological findings, and may can cause sudden rupture and sudden changes. So most common aneurysm in brain is saccular aneurysm. Saccular type of aneurysm is most common aneurysm, and this type of aneurysm, this pathological outpouching, is seen in the anterior communicating system. In this system, in around 85% cases, this is seen in anterior system in around 85% cases में anterior system में मिलेगा. Now the between anterior cerebral artery and the anterior communicating, there in 30 to 35% cases में यहाँ पे मिलता है aneurysm. And what is the pathological phenomenon in this aneurysm? Aneurysm can have can rupture, sudden rupture leads to the various symptoms due to hemorrhage, maybe the sudden subarachnoid hemorrhage may be there because of rupture of aneurysm, and maybe loss of vision, maybe involvement of this frontal cortex defective movements, and physical movements will be deficit, and all these kind of symptoms will be there. So first is the aneurysm, and most common aneurysm is Berry aneurysm. So Berry aneurysm is most common aneurysm that is seen in circle of Willis. Now second is the infections. So it is very much important for infection point of view, because the arterial system is interconnected. So that's why infection may travel from vertebral basilar system to cranial system. So that's why it is very much important for infective point of views. Now the circle of Willis is in itself is may be important for various kind of strokes. There may be sudden blockade of artery, there may be hemorrhagic stroke, there may be infarct and all. So there may be various pathological changes and symptoms. So guys, as you can see, this is the base of brain and this is the circle of Willis, which is made by the two vertebral arteries are forming a basilar artery. So this is basilar artery, and this is the internal carotid artery over there, which is giving anterior cerebral artery. This is the anterior cerebral artery, and this one is the posterior communicating artery, and this is the middle cerebral artery over there. Now this posterior communicating artery is communicating between the anterior system as well as the posterior system, and this is having the pituitary stalk as well as optic chiasma in the interpeduncular fossa surrounded by circle of Willis. This is the anterior communicating artery over there. So this is the circle of Willis, and at the level of this pons there are various labyrinthine arteries which are the branches of basilar artery. Okay, so this is the branch of the posterior cerebral artery, which is a branch of basilar artery. Bilaterally over there, this is the posterior cerebral artery, posterior cerebral artery, and this is the basilar artery at the surface of pons. And the vertebral artery divides in and at the level of unites and forms the basilar artery at the level of pons and medulla. So this is the complete circle of Willis, and the most common aneurysm are formed in the anterior system. Circle of Willis is basically the anastomosis or the connection between the anterior, the internal carotid system as well as the posterior vertebral basilar system.